If you've done heart surgery, if you've operated on the aorta, if you operated on the mitral valve, you've probably heard of Dr. Tirone David. Many people know Dr. David as a master surgeon, but I think few people really appreciate Dr. David as a person. My name is Nguyen. I'm the lead of the Miami Cardiac and Vascular Institute. I'm also a surgeon, and today we have the privilege of interviewing Dr. David. And one of the things that I try to do is try to get to know people as people first and then as a surgeon. Dr. David, you were born in Ribeirão Claro, Brazil. Describe to us your early childhood, what you did for fun, some of your fondest memories, your siblings, some family influence.
I was born to a middle-class family in a very small town in south of Brazil. Most people there were either Portuguese or Italian descendant or immigrants. I was the oddball because my family is a bit more mixed. Like my name, my mother was Italian, my father was not. But I don't have detailed recollection of my childhood, but I was a very happy kid. If you live in a small town, it's like living in a kibbutz. My mother never worried where I was, what I was doing. And I remember you disappear, like going to school, but before school even, you disappear at 8, 9 o'clock in the morning and don't show up dirty, messed up with mud.
And what were you doing in the mud? Were you playing around?
Playing around.
Yeah.
It's a very small, it's almost like a village. So we had to leave the village, go in the woods or water, go fishing, go cycling. I learned to use a bicycle very early, and my friends did as well. It was fun.
So in many ways, a regular kid, just kind of having fun in a small town in Brazil. Yeah. Tell us about your parents and the relationship you had with your parents and how they influenced who you are today and your upbringing as a child.
Well, my mother was a typical Italian mother, very protective, very, she, being Italian and Catholic, she thought one of her boys should become a priest. And I didn't want anything to do with priesthood, but, and my father was not Catholic, so, but he was a very difficult man. Recollections of, I was never good enough. Mm. You bring the report card instead to congratulate you and say, boy, this is pretty impressive. To give an example, when to enter medical school, there were about 1,800 candidates for 100 positions.
Wow.
There's an exam, 3 days exam, and I came in second.
Which is pretty good.
So I come home and to tell my parents when I go into medicine, and he says, there's one guy out there better than you are. I mean, Dad, 1,800, I'm 1799. That's not that bad.
And how did that make you feel as a child? Did that cause any tension with you in your relationship with your dad, or did it?
No, not really. It was his way with everything.
Yeah.
If you didn't do right, it was always correcting. And I tried to apply the same strategy to my daughters. It didn't work at all. It backfired.
Yeah.
So.
Yeah, it's always tricky. Tell me more about, as a child, about who inspired you and who are your heroes? Who did you look up to? Who did you emulate?
When I turned 10 or 12, I had an uncle who was my father's brother, Gabriel, his name. He was a pharmacist. In those days, 70 years ago, or 65 years ago, pharmacy wasn't like now, that you prescribe a medication, take from a box. Most medication were a compound.
Yeah.
The physician will prescribe the composition of every component of a drug, and the pharmacist, the compound pharmacist, they had to mix them. I was fascinated by the way he was able to take a gram of something, extract a milligram, and combine to make a pill. I mean, so by the time I was 14, 15, I want to be a chemist. So I want to be just like my uncle, because that's the only thing I knew.
So I want to expand upon that a little bit, because it's fascinating, because we know you as a doctor, we know you as a surgeon, but as a child, you actually did not want to become a surgeon.
No, I did not. I didn't like blood. Every time I saw blood.
And you had an ultimatum from, tell us the story, from your father.
My father is one that but when I was 14, he said, you have to go to a high school of a higher caliber than we have here. So he sent me to a big city, and which was a shock, being 14-year-old and living alone in a large city. So when I was finishing high school and preparing for college, he said, medicine or nothing.
Medicine?
I said, no, I want a chemistry. He said, no chemistry. You're gonna be a doctor. So I said, fine. So I went to medical school, and soon after, 6 months after medical school, in those days, the course was not like it is now. More the French system, which is similar to the French system. It was 2 years of basic sciences only. You don't see patients, you don't know anything about disease. You learn how the human body works. So at least 2 hours a day, I spent dissecting cadavers, learning how the human body is made. And I was fascinated by you know, you start dissecting an arm, how your hand works, all the muscles, and I thought that was the most intriguing thing in the world. Then the physiology of that. So by the end of the first year, I thought my father knows more than I do. I guess he knew that that's where my heart was. And the passion happened. I have no regrets. I love medicine.
So if your father didn't draw the ultimatum, you would be a chemist right now.
Absolutely.
Do you ever look back and think, you know, what your life would have been like if you were a chemist? You might still be in Brazil.
Well, in Brazil, I could have discovered polypropylene.
That's true. I have a feeling you wouldn't have stopped just being a chemist.
So,
you would be a good chemist.
Yeah.
Wow. In the 1970s, you came to the United States. Tell us about that decision-making process. Back then, people didn't go to the U.S. very often.
No, it was very rare, as a matter of fact. Most Brazilians would go to Germany or France or England to train and to acquire superior knowledge in medicine. My mentor, however, during medical school, and the man who was very influential in my decision to become a surgeon, was a master surgeon. He's the one that you have to go to the United States. So 1 year before I finished medical school, I started preparing myself to take the American exams to be able to come here. And he helped me a lot to find a residency and in those days, internship, which you don't have anymore now. So I came to New York for my surgical internship.
Describe to us, paint us a picture of you coming to the United States for the first time and then getting off the plane and walking around New York City as a fresh
Not in New York City, in Brooklyn.
In Brooklyn.
Brooklyn was not the most friendly place in 1970. I mean, I was only 23-year-old, and it's a bit scary initially. But then, you know, either you adapt or die. So
was it inspiring, or was it?
No, on the contrary, I was horrified.
Horrified.
I thought Brazil was primitive and awful. But when I came to Brooklyn, I said, "My gosh, we are ahead of these things here." And and then, of course, the language barrier is a major problem. And to start practicing our English in Brooklyn probably is the wrong place to. And there was a lot of trauma and violent trauma. And I internship at Kings County Hospital. It's a 4,000 bed hospital. I mean, that was quite a shock, but I survived. By then, I wanted to be a heart surgeon. So I started looking for residency in places where they had the well-developed cardiac surgery.
And at some point during your training, tell us a story where one of your patients was apparently exsanguinating, and you did something to make sure the patient lived. You offered some of...
No, this is my first year in practice. In those days, I didn't have the control that we have in blood transfusion like we have now. I had, during medical school, not medical school, I'm sorry. During my residency, I heard a very famous hematologist, Winthrop was his name. Never forgot the man's name. He was an older man when I was 25, 26-year-old, but he impressed upon me, he said, coagulopathy, any coagulopathy can be cured by giving someone fresh, warm blood. In other words, somebody is exsanguinating because the blood doesn't clot. If I give my blood to him, you clot.
And that's what you did. You gave your own blood.
I thought this is So in that concept, inside the plate, remember, you didn't have all these components that we have today. This is 1978 when I started practicing. A patient was exsanguinating, nothing would clot. So I recruit 3 or 4 people, everybody the same blood group. Each one gave a pint of blood. I gave my own to start the example. So I gave a unit from my arm to the patient's arm, and in half an hour, it was dry like a bone. But then, of course, everybody came after me. You're crazy, or lose your mind. And
we're not allowed to do that anymore. But
no,
but
today
you
probably go to jail.
But you saved that patient's life.
Absolutely.
And even now, as you know, there's value to whole blood, especially in coagulopathic patients. We don't think about it, but some places actually routinely give whole blood as well. When you look back, do you ever think, what was the inflection point for you? What point did you feel like your career, your life really changed? Was it in childhood? Was it, coming to the United States? What would you say, like one point in time?
Several. Leaving the kibbutz that I grew up on, a very protected environment. I mean, my mother never worried I was going to have lunch or because I have a neighbor or a guy 3 blocks away would feed me if I was playing with you. So if you're in my house, you're part of the family. That's a very small town kind of mentality. So leaving that environment and going to a big city, that was quite a shock. Where the people are indifferent, they don't care if you, actually, a month or 2 I was there, I fell off from a bus. The bus was packed. I fell and I was bleeding not to death, but I was bleeding a lot. People walking by didn't care about this. 14-year-old with a scar in the chin.
Walked by you, huh?
So somebody took him to a hospital and put some stitches. I still have the scar, but so that was a shock. And then coming to Brooklyn was a shock. But that was the end of the shock. Then was all very smooth sailing. The difference between Brooklyn, Kings County Hospital, and Cleveland Clinic was like night and day. It was
you survived Brooklyn
in the 70s. Gentlemen, so people are very kind, very.
Let's change gears a little bit. Let's talk about research, scholarship, and mentorship. Describe to me your first manuscript.
The Cleveland Clinic had a very structured training program. As a R1, they allow them to open. Those days, everything was open. They used to cut the stomach, cut the chest, and so you'd open, and they let you close it. They would teach you how to close. So Prolene came by, or polypropylene. But the knot of a number 2 Prolene is pretty bulky. So I asked my mentor, can I invert this? He said, what do you mean invert? Put the knot under the fascia. Close the peritoneal, put the knot on the fascia. He said, well, go ahead and do it. In a thin person, the knot would protrude like a wire in a skin person's sternum. So I did 1, did 2, did about 100, and the attending was so impressed. He said, we should publish this. So my very first paper, I was 24-year-old, or maybe writing a paper on bearing suture knots in laparotomies.
Well, this is fascinating because I thought I knew a lot about you, but I didn't know you actually contributed to that as well. So we do that routinely now and bury the knot.
Absolutely.
And I didn't realize that you.
But if you look at the original publication, 1970 is 71, I guess was. I think the journal still exists, Surgery of Obstetric Gynecology.
I'm going to look it up.
No, I'm telling you, in my CV. And then the second one was a bit more complicated because I was intrigued by carotid artery bruits. Today, there's nothing, but 1971, carotid artery bruit, nobody knew very much about. And in those days, surgeons are doing the angiography. We puncture the artery and inject dye and see the stenosis. So I made a correlation between the bruit and the angiography. Submit for presentation at the Society for Vascular Surgery. Was accepted, the abstract. And coincidentally, in Toronto.
Wow, full circle.
So it was the first paper I ever gave, and I was pooping my pants. Look at the audience, 1,000 people. So how can you talk to 1,000 people? So my mentor, a wonderful guy called Edwin Bevan, whispered my ear. He said, no one here knows more about bruit than you do.
That's true.
I said, That's true. So I stood up there and spoke like I was an expert.
Yeah. Well, you are an expert. You've written so many.
Not about Bruce.
Yeah, but you've written so many papers. What's your most memorable paper? What's the one that you're most proud of? I know there's so many, from proline to mitral disease, aortic disease. But if you were to say this is a paper that you want to hang your hat on.
Now, it's ironic, and if you saw Dave Adams propose to the board of the AATS, and they approved. So Dave Adams was able to raise over $1 million for honor your mentor, Tirone David.
Congratulations.
And I was asked this question at the dinner to celebrate this, and I had to think for a second. I said, yes, the David operation. I mean, I'm very grateful, eternally grateful to my peers, to my friends that decide to call this operation David operation. But if you take a look at the surgical impact, dramatic for surgeon to do the operation.
Yeah.
But not to patients in general everywhere. But if you take a look at Gore-Tex to replace and repair a mitral valve, that's I bet you use Gore-Tex.
Well, you know I do.
Every surgeon
Yeah.
uses Gore-Tex.
Well, I use Gore-Tex.
And if you read
yeah.
the first paper ever published on Gore-Tex repair mitral valve was mine.
Yeah.
I saw surgeons using for elsewhere. I said, why don't you use for chordae tendineae? So as far as impact concerned, chordae replaced with Gore-Tex by far more important than David operation.
Wow.
Infarct exclusions it changed the way myocardial infarction behaves. I mean,
Yeah.
you know, for rupture myocardium, rupture septum.
Yeah.
And there's a number of them. The UFO or commando operation.
What operations now? You've done so many operations. When do you get nervous? Do you ever get nervous anymore operating?
I do if something bad happens during the operation. But after you've done 15,000, I mean, very frequently I make a technical error. And I firmly believe that if you bring the patient to the operating room and do the operation by the book without adding pathology,
Yeah.
the patient do very well. So I after 40-some years in practice, I still thrive by doing operation without making mistakes.
As we wrap up, I'm going to ask another series of questions. Looking back at your life, it's kind of a standard question, but would you have done anything differently? Do you think you would have, maybe approached something differently, or maybe enjoyed life a little bit more, or what would you have done differently? There has to be something you would have done, maybe a little bit differently if you could.
Likely so, but I don't know if you ever saw the lyrics of the Canadian songwriter Paul Anka on My Way. Yeah, I made a few mistakes, I have a few regrets, but very, very few to dwell for too long. My wife was probably the best decision in my life was to marry her. We had 3 daughters. I was not a father, but I chose the right women to raise my children.
Yeah.
So she's a wonderful mother. The girls are very, very close to her. And they all live in Toronto because they want to be next to their mother. They don't care very much about me, but that's life. Perhaps if I had spent more time with them, I would have been more meaningful. But
What advice do you have for 3 groups of people who are aspiring to become a cardiothoracic surgeon, people who are young cardiothoracic surgeons, and people who are maybe more experienced cardiothoracic surgeons, if the advice would be different or the same for each of those 3 groups?
Certainly different. To the younger one, I would say you chose the right profession, the right career. I don't think there is anything out there more gratifying than heart surgery.
I agree.
You work harder to do it, but the outcome and the glory of see a patient dying, come back to life, there's no money, nothing can replace this.
Special.
It's very, very special. And those are perhaps the beginning, and there is a lot of opportunities to make things better. Mm-hmm. And I truly believe, I don't want to sound like a priest like my mother wanted to become one, but I truly believe that each one of us are supposed to leave here better than we found. it has been my main drive in life. Try to, whatever you do, try to do a bit better than. And in the senior surgery, will be no exception. The more experienced person.
What's next for you?
I
You've
don't
done so
know.
much already. What's next?
I'm pretty old, and I still. Luckily, cardiac surgery is easy to know when you begin to fault. It doesn't take a genius to say, hey, you're too old, you're making mistakes. I'm not there yet.
You're not there. I've operated with you. Yeah.
So, but I want to stop before I get there.
Yeah.
So I likely I'm going to stop from clinical practice next year. I'm going to stop doing surgery independently. I might be a mentor. I'm going to start traveling a bit more to teach people but to stand on the other side of the table, which I didn't do very much in my career. I stood on the right side of the patient for too often when I should have let the fellow and resident do more. I'll do now. I'm going to try to compensate by going to these places and teach them things I know. And
well, there are a few people who've impacted the field of cardiac surgery more than you.
And then, like anybody else, I'd like to write my memoirs or a book describing all the experiences and the one that is useful to somebody else.
Yeah. Well, Dr. David, thank you for being a hero for many surgeons out there, including myself when I was younger, in the early stages of my training and even my mid-level. Always looked up to you and all the contributions you've made.
Thank you,
that
Tom.
you continue to make. It's really a privilege to spend this time with you and really hopefully share with others parts of you that they didn't know. One last question as we wrap up. Tell us something that other people might not know about you, that I might not have touched on so far.
I'm a perfectionist.
People know that already.
No, but wait. 2 or 3 mentors of mine said that you're not perfectionist by nature. You're a perfectionist because you have a mental disorder called the immigrant complex. And to be quite honest, I felt like an immigrant in the United States during my internship and 4 years of residency. The moment I stepped in Canada, I did not feel immigrant. I felt like I was one of them. Canada, back in 1975, when I came in as a resident, was much more of a melting pot. So is the United States, but the United States, unless you adopt the American way of life, you are looking at. It might be true that Bigelow is want to point out the first time. You don't have to prove that you're better than me to be one of us. He claims that I was struggling to be better than anybody else. I said, you don't know my father then. I was better than 1990 doctors or students. But there's one better, my father pointed out, there's one guy better than you. So perhaps may not be immigrant complex, but might be this need that our parents put in your head that you have to perform, you have to be a perfectionist. Or it could be innate, I don't know. I'm very critical of myself and others.
Yeah.
But I never criticize others without criticizing me first.
Right.
I don't expect anyone around me to do what I wouldn't do.
Yeah.
Be clean a floor in the operating room, which I have done many times, mop the floor to expedite the turnover. I don't think any job is unimportant, particularly in our area.
Absolutely. Thank you so much again for your time.
Pleasure.
And,
Thank you.
And it was a pleasure learning more about you. Thank you, Dr. David.
Thank you, Tom.